everyone, Eileen Bayer, the fam here. Welcome to the fifth installment, or the sixth, I've lost track because this is our longest mini-series on bipolar. In this series we are going to be covering the rapid cycling, which I use this demonstration of a roller coaster to show you how it kind of rapid. It will go like this in the loops. You know, like a roller coaster, you have a little break, and then you go up here, go through this loop, you get a small break, then you get another one. So people with bipolar, their moods is like that. They'll go through these cycles where it's like a roller coaster ride for them, but not a fun one. So today we're going to talk about the rapid cycling. As I stated, tomorrow we will cover the management of bipolar disorder, of all three of them. It might be a part 1 and part 2 series. I won't know until I see just how much notes there has to be on there. But that will be, once that's done, that will be it on bipolar. And then next week we will hit another one, which I haven't decided what one we're going to cover. But saying that, let's get this on the road and get going. Okay, rapid cycling. Most people who meet the criteria for bipolar disorder experience a number of episodes, in an average 4 to 7 per year, with each lasting 3 to 6 months. Rapid cycling, however, is a core specifier that may be applied to any of the above subtypes. So what it's saying is, when a person's life is like this, that's going to last for 3 to 6 months. And they'll have that between 4 to 7 times a year. So if they have that for 3 to 6 months, you look at it as, okay, we'll take the least, which would be, if they have it 4 times a year, that's at least 1 per season. Okay, because 4 times 3 is 12. If they have it 7 times a year, that's more, almost like 2 per season. A little bit more than 2. Let's see, 3, 6, 9, yeah. So, depending on how many, but you're looking at least once every 3 months. Now, if they have it for 6 months, that's a half a year that they could be going through this. That's a long time. 6 months is a half a year. Think of it. That's a long time. And it's not something they like. It's not something they have control over. If you remember in the previous episodes we did, where I showed you the picture of what a normal brain looks like and what a brain looks like with bipolar disorder, that's their brain. You have no control of what the inside of your brain does. You have no control over that. So it's important that we don't judge them when they have their episodes, because they have no control. If a person with bipolar, I know many people that have it, if they were asked if they could have one wish granted to them, what would that be? You wouldn't believe how many of them would say, I want a normal life. I just want to be normal. They don't like what they go through. They don't like these cycles. They don't like the outcome. And we have to understand that this is something they have no control over. And there's no way, there's no set prevention for bipolar disorder. Now, we could sit there and say that the prevention part is as less stress as possible. But how is that possible? To live on an island by yourself, there's still going to be stressors. You got to think about, okay, you think, just take an example. You're on an island by yourself. What type of stressors could be there? There's plenty. You have the stressor on how you're going to eat. You're going to have the stressor of shelter. You're going to think about, okay, what if a tidal wave or anything like that hits? You're on an island. So no matter what you do, there's stress in life. There's no way around it. There is no such thing as a stress-free life. We can make it less stressful. Excuse me, but there is no such thing as a stress-free life. Okay, so they have no control, and we all need to remember that. Okay? Okay, we said that it goes 3 to 6 months, and it's a course that can be applied to any of the 3 subtypes. So the rapid cycling it can be applied to bipolar 1, bipolar 2, or the third one, which I have a hard time saying the name, so I'm going to call it bipolar 3. Okay, but the rapid cycling is applied to all 3 of them. Okay? And it is defined by having 4 or more disturbances, episodes within 1 year span, and is found in a significant proportion of individuals with bipolar disorder. So 99% of people that have bipolar disorder will have this rapid cycling, as it says, because they end up having the 4 or more. Whether it's manic or the depression, but they go through it. Okay? These episodes are separate from each other by a remission, whether it's a partial or a full remission, for at least 2 months, or a switch in mood polarity. So they have, the brain either gives you a 2-month break of normalcy as much as possible, or you're going to go from manic to depressant or depressant to manic. That's not a very good choice, just for 2 months. And then you're right back at the cycling that will last 3 to 6 months, and then a 2-month break. So you can see their brains is functioning so much differently than ours, and they have no control over it. Okay? Now, a depressive episode to a manic episode, or vice versa, is what I was just saying. It could go from manic to depressant, or depressant to manic, or they could have their 2-month break. The definition of rapid cycling most frequently cited in the literature, including the DSM, is that a Dunner-Fiev, at least 4 major depressive, manic, hypomanic, or mixed episodes are required to have occurred during a 12-month period. Now, ultra-rapid, which is days, in ultra-rapid, or ultra-dion, within a day, cycling have also been described. In other words, rapid cycling can go a day or it can go days. But this is what their life normally looks like. This would be like their 2-month cycle here, and then they go through the rapid cycling, and then they have like their small 2-month break, and then they go through another 2-month cycling, And then it just goes over and over and over for them. So it's not a very nice lifestyle for them. It's one that they wish they didn't have. I have a few friends that are bipolar. They are being, they are taking their medications and getting their treatment for it. But one of my friends says that when they were asked if they could have one wish granted to them in life, what that one wish would be, they said to be normal. And 99% of them want that. They want a normal life. It's not that they don't want it. So, when we see somebody having a manic episode or whatever, don't be quick to judge them. And when they go on their depressive episode, watch for the signs of depression. We know about regular depression, but watch it because this will be severe depression. So look very carefully for all the signs of depression. If you don't know what they are, go back into my series, not this series, but one in the very beginning on depression, anxiety, and loneliness, and try to get them to incorporate in these different things, because when somebody with bipolar goes through their manic depression, they are in the most extreme thing there is. And they will go and harm themselves. They're not, when they're in their depressive mode, they're not a harm to you, they're a harm to themselves. And they do need help at that point, really bad if they're not on any type of medication yet. They do need help. So make sure you look for them, because you could save a life. Because when they get to that state, you don't know. They could walk into traffic deliberately because they just want to end their life. And you have to understand where they're coming from, but know that that's not normal thinking. And normal thinking, their brain's not going to comprehend that regular thinking. So you need to do what you have to do. If you have a phone on you and you see them doing something, immediately call and get help for them, because they deserve it just like you would. If I was to see somebody crossing a busy highway, and if I tried to call them in and they just kept going forward, I would immediately call 911. And I would do everything I could in the present to get that person out of the street. Because they're not thinking right. That's why when diagnosing bipolar disorder, why they say some of them could be inpatient, because if at the time that they're being diagnosed they're going through their manic depression, then they need to be in a hospital where they can be watched. Okay? Because this is not controlled just by every day. That's why I said the next part of this lesson could be 2 parts, because there's a lot to take in consideration, because bipolar affects the brain. Like I showed you in the previous episode where I had the picture of a normal brain and one with someone that, a bipolar brain. You could clearly see how different and distorted it is. And it's not that person's doing. And they need us to understand them and love them. And if they're on medication or whatever, and you're close to them, talk to them, ask them, when you go into this, what is the best thing I can do to help you? Get involved. Get involved, ask them, do you want me to go to your doctors with you so I can learn on what I need to do to help you? That's what a friend would do. A friend gets involved with the person they care about, whether it's a friend or a loved one. It comes from the heart. Open your heart to them. Don't close them out because they have this disorder. It's not their fault. Accept them, love them, understand them, and do everything you can to help them. Okay, and like I said, tomorrow may be a 2-part series. It depends on the notes. I'll know before we start tomorrow, and I will let you know. But when I am done, if it's just a 1-part or 2-part, doesn't matter how long, this will be the end of the series. If it's a 2-part, it will be 2 more days. If it's a 1-part, well, then it'll be finished tomorrow. But I haven't decided what the next subject will be. But it will be another good one. I can promise you that. And, you know, I just encourage you to take part in your friend or your loved one that has bipolar and learn from them. Ask them questions, get involved, let them know you care. If you say nothing, they don't know. And remember, no question is the only stupid question is a question unasked. Okay? So remember. So I'm going to leave you with this thought. Remember to always see with your heart and not your eyes, because your heart sees inward and not outward. When you see with your eyes first, you see from the outward in, and you prejudge people. Seeing from somebody from the inside out, you do not prejudge. You see them for who they are, not the way they look, not the way they dress, not the way they talk or walk, or any of the superficial things. You see them for who they are inside. And remember, you matter to me. You were uniquely made. You're one of a kind, and I love you. So, mwah! Until tomorrow. Bye.